When you do an NAD IV, what you have to realize is you're getting a huge spike in NAD levels over a short period of time, but it's clearing very quickly. The analogy I like to use with NAD is, let's pretend we're going to go hiking in the mountains today and we know we're going to need water. So you have three options for water. Option A would be like getting a sub-Q injection, which I know a lot of people do sub-Q injections. But the problem with sub-Q injections, remember, NAD half-life is an hour to 2 hours, and you're just not getting enough, because if you're doing sub-Q, you're probably doing about 50 milligrams. If you do more than that, you won't feel good. So that'd be like kind of when you go to the dentist, that little sippy cup they give you, and you're drinking a little sippy cup. Might quench your thirst for 15 minutes or an hour, but it's going to clear your system really quickly, so it's just not enough. If you get an IV, typical IV is 500 milligrams, but that's a 3-hour IV. And what you're experiencing is NAD has such a strong effect on the mitochondria that if you do too much or too fast, you have to remember the highest concentration of mitochondria is really three places: the ovaries, the heart, and the brain. So what you're going to feel if you do too much IV too quick, you're going to stimulate the mitochondria. You're going to have chest discomfort, potentially headache. The areas where you have a lot of mitochondria, you're going to feel it, and it doesn't feel good. So when you get an IV, it'd be the equivalent of, hey, we're going to go hiking. Let's chug a gallon of water. So you can chug that gallon of water. You're probably going to feel bloated, not that great. Going to be better than the sippy cup. That might quench your thirst on this hike for a few hours. But once again, once you're 4 or 5 hours into this hike, you're going to become thirsty because you just loaded up in the beginning, but it cleared your system. With the iontophoresis patch, we're able to give you a higher dose. We're going to get 1,300 milligrams, but it's dispensed over 12 hours, so you don't get any of those weird feelings. It doesn't overstimulate the mitochondria, because instead of getting this huge spike, it's going to be a more level. It's kind of like wearing a camel pack, so your cells can pull on the stores whenever they need it. You're not just loading down on it. So using NAD via iontophoresis is a much better way to get NAD. You're going to get a higher dose over a longer period of time, which has a much better effect on the mitochondria and the cells and the benefit that you're looking for.